Anatomy 32, Chapter 11, the muscular system. Topics, muscles that move the lower limb. So, the lower limb includes the thigh and the leg. The thigh has three compartments. The anterior compartment are muscles that extend the leg, the portion underneath the knee. The hamstrings in the posterior compartment that extend the thigh and flex the leg. And then in the medial compartment, muscles that adduct the thigh. All right, so here we have two muscles, psoas major and iliacus, and they go down from the vertebral column and the os coxae, insert into the femur, and they can flex the thigh. So both of these muscles flex the thigh, and collectively they're known as iliopsoas. We're going to learn them as two separate muscles. Then we have this very small muscle. You can just barely see it. It's a small muscle called pectineus. Pectineus has its origin in the pectineal line of the pubis, and it inserts into the epictineal line of the femur. And those lines are invisible to our eyes. It flexes the thigh at the hip and also can adduct the thigh at the hip. Then we have adductor longus. Adductor longus origin is in the pubis and inserts into the linea aspera of the femur. It adducts the thigh at the hip joint as expected, and it also can flex the thigh at the hip joint. Then sort of posterior is this large, deep muscle called adductor magnus. So here's looking at it from the anterior side, here from the posterior side. This large muscle has its origin in the inferior ramus of the pubis and the ischiotuberosity, and its insertion is the linea aspera of the femur and the adductor tubercle of the femur. What does it do? It adducts the thigh and can also flex the thigh at the hip joint, and it also can extend the thigh and laterally rotate the thigh at the hip joint. So flex and extend, because again, it is a very large muscle, so only part of it needs to contract to lead to the flexion or the extension. Then we have this very medial muscle called gracilis. Its origin is the inferior ramus of the pubis, and it inserts into the upper medial surface of the tibia. So it also crosses the knee joint. So it can adduct and flex the thigh at the hip joint and flex the leg at the knee joint. Probably when it does any of these things, it's acting as a synergist and not the primary mover. All right, we also have sartorius. Sartorius goes from the lateral side at its origin at the anterior superior iliac spine, then crosses over to the medial side and inserts into the tibial tuberosity of the tibia. And so it crosses again two joints, the hip joint and the knee joint, so it can flex and rotate the thigh laterally at the hip joint, and it also can help to flex at the knee. To go to the posterior side, we have the large gluteus maximus. Gluteus maximus can extend the thigh at the hip joint and also laterally rotate the thigh at the hip joint. If you remove gluteus maximus, you have below it gluteus medius. Gluteus medius can abduct the thigh at the hip joint and also medially rotate the thigh at the hip joint. Laterally rotate, medially rotate. And then if you remove gluteus medius, you have gluteus minimus. Gluteus minimus also abducts the thigh at the hip joint and medially rotates the thigh at the hip joint. So medius and the minimus have the same actions. Also underneath gluteus maximus are these four smaller muscles, piriformis, superior gemellus, obturator internus, and inferior gemellus. So boom, 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 boom. And these four muscles can laterally rotate the thigh at the hip joint. Then on the lateral side of the thigh, we have this really small muscle called tensor fasciae lati. Its origin is the iliac crest and anterior superior iliac spine, and it inserts into the iliotibial band, which is the sheet of connective tissue or fascia that stretches down to the knee. So it can abduct the thigh at the hip and also medially rotate the thigh at the hip. Flipping over to the posterior side, we can look at the hamstrings. First up is biceps femoris. Biceps femoris has its origin in the ischiotuberosity and linea aspera of the femur, and it inserts into the head of the fibula. So this is a lateral muscle, and it can extend the thigh at the hip and also flex the leg at the knee. Medial to it is semitendinosus. Semitendinosus has its origin on the ischiotuberosity, and it inserts on the medial surface of the tibia, and it can extend the thigh at the hip joint and flex the leg at the knee joint. And then if you remove semitendinosus, you can see semimembranosus, and this, the third of the hamstrings, has its origin in the ischiotuberosity, inserts into the medial condyle of the tibia, and it can extend the thigh at the hip and flex the leg at the knee. So all three hamstring muscles do the same actions: extend the thigh at the hip and flex the leg at the knee. Back to the anterior side, we can now look at the quadriceps femoris group. First up is the anterior rectus femoris muscle. The rectus femoris muscle has its origin on the anterior inferior iliac spine, and it inserts into the quadriceps tendon that leads to the patella, then it leads to the patellar ligament that inserts into the tibial tuberosity. And this muscle crosses two joints, hip and knee joints, so it can extend the leg at the knee and also flex the thigh at the hip. Then we have the two vastus muscle, two more of the quadriceps femoris muscles. Vastus medialis on the medial side, going from the intertrochanteric line and linea aspera of the femur, inserting to the quadriceps tendon of the patella. And then the vastus lateralis, its origin is the greater trochanter and linea aspera of the femur. It inserts again into the quadriceps tendon that leads to the patella. And they both extend the leg at the knee. And then if you remove rectus femoris, underneath it is vastus intermedius. Vastus intermedius has its origin in the anterior lateral surface of the femur, and it inserts into the quadriceps tendon leading to the patella. And it also extends the leg at the knee. So all four muscles of the quadriceps femoris muscle group are able to extend the leg at the knee, but the rectus femoris muscle can also flex the thigh at the hip. Then further down we have tibialis anterior. It's on the anterior side of the leg. It is adjacent to the tibia. So tibialis anterior has its origin the lateral condyle and shaft of the tibia, and it inserts into the metatarsal 1 and medial cuneiform, which should also be known as cuneiform 3. And it can dorsiflex the foot as well as invert the foot. So turn the foot's bottom of the foot is facing medially, that's inverting the foot. Dorsiflex the foot, pull on it so that the top of the foot is going upwards. Then we have extensor digitorum longus. Extensor digitorum longus has its origin in the lateral condyle of the tibia and anterior surface of the fibula. And it inserts into phalanges 2 through 5, so it's going through toes 2 through 5. It can help to dorsiflex the foot and also extend toes 2 through 5. Then on the lateral side, we have fibularis longus, running along the fibula. And its origin is the head and shaft of the fibula and the lateral condyle of the tibia. And it inserts into metatarsal 1 and the medial cuneiform bone. And it can evert the foot. So turn the foot so the bottom of the foot is facing more outward or laterally. And it is also a weak plantar flexor, so flexing so that the base of the foot is going down. Then we have this large muscle in the back of the leg called gastrocnemius. It has two bellies, as you can see. It has, therefore, two origins. The lateral, one origin from the lateral condyle of the femur, and the other one from the medial condyle of the femur, and it inserts into the calcaneus bone. And it can flex the leg at the knee because, again, it's crossing the knee joint, and also plantar flex the foot. So standing on the balls of your foot or moving your foot so that it's going more down. If you remove gastrocnemius, you have the muscle soleus. Soleus by itself. It goes from the head and shaft of the fibula and the medial border of the tibia and inserts into calcaneus. And when it contracts, it leads to plantar flexing of the foot. Remove those muscles, and then you can see below that flexor digitorum longus. Flexor digitorum longus has its origin in the posterior-medial surface of the tibia, and it inserts to the distal phalanges of toes 2 through 5. So it's able to flex toes 2 through 5, as well as plantar flex the foot. And then further back, we have tibialis posterior, so it's on the back side of the tibia. Origin, tibia and fibula, and interosseous membrane, and it inserts into metatarsals 2 through 5 and in some of the tarsals. And it can plantar flex the foot and invert the foot, so turn the foot so that the bottom of the foot is facing medially. And that is it for this part of chapter 11.